Diaphragm is a part of that intrinsic core musculature. Intrinsic core meaning it's our deepest layer of core musculature. You go any deeper and you're looking at ligaments, cartilage, bone. So this is really our kind of the last area in which our body has the ability to stabilize muscularly. You go any deeper and it's locking in joints, compressing joints. One of my clients who I see virtually, he had a coughing fit, and that coughing fit created a spasm right at his 12th rib, diaphragm. And so in our session yesterday, I got to walked him through doing some diaphragm work, and largely working on bringing in breath with movement. And the idea with the breath and movement is to encourage length and activation of the diaphragm while encouraging movement. What'll happen is if we have some kind of instability in the shoulder or in the hip, and this particular client has some shoulder and hip instability, it's one of the things we've been working on. The diaphragm can compensate, create tension, because that tension then helps to stabilize those other areas. But when it stabilizes, it loses the ability to dynamically lengthen on its own, and then it can become quite painful and uncomfortable, affecting our breath. It's harder to get a deep breath in, especially to that whatever side that compensation might be taking place on. So we did some diaphragm release work, and then did some positional breath work. By the end of the session, he had a good 80–90% reduction in the discomfort. It was still a little tight, but it was no longer painful, and he was able to get into the positions without pain. If there is an active pain or an active spasm in that diaphragm to where movement is painful, want to be very, very aware of working at the level of our rules of pain. I do not want pain going into a level 3 or above. I want it to stay below that level 3. Even if we're just doing breath. If you have pain on your inhale or on your exhale, I want to try to keep that pain level below a level 3. Then as soon as we start encouraging movement, it's the same thing. We have to stay on the slight discomfort side of pain. And remember that level 3 is when we start to move and it starts to show up on our body. We start to tense up. Our body goes into protective mode. That's the opposite response that we want when we're trying to get length and activation, especially in the diaphragm. A way to assess whether we have a diaphragm that is related to a pain pattern. If there is pain or discomfort associated with breath, on my inhale, I feel pressure at the depth of that inhale. As I go deep into that inhale, it starts to get pressure or turns into pain. Or on the other side, exhale. On that exhale breath, I get deep into that exhale and there's pain. Might be localized pain. You might feel it more in the low back, but generally it's going to be in this kind of rib cage area. It could be more shooting pain going up into the shoulder, posterior shoulder, back of the scapula, up into the shoulders, even into the neck. So how we can assess for whether it is a diaphragm relationship to that pain or not a diaphragm relationship is a very simple one. First is we want to get into a relatively comfortable position that we can maintain without pain, sitting position hopefully, or possibly lying down on our back, and then doing nice slow inhales in through the nose and out through the mouth, and getting into our crocodile breath, but starting very, very shallow, not going deep into the breath, starting shallow and slowly working out until we start to feel that slight discomfort under a level 3, but we can feel the trigger of that pain. We're breathing in to the point where we can assess, yes, breath is a little bit uncomfortable. At that point, we can take one hand and just lightly palpate on that last rib, nice broad touch. And then go through that same breath. Inhale, exhale. And the question is the pain associated with the breath better, same, worse? If it's better, then we can, that would be a positive that there's possibly a diaphragm. Same thing with worse. If it's worse or better, those are going to be possible relationship of a diaphragm. If it's not on one side, then we can do the same thing on the other side, because it'll tell us which side that relationship pattern may be on. And I'm saying maybe. These are not definite. This is not a clear evidence. This is a possible correlation that we can then go and experiment on to see if we can get some improvements in that pain with our breath. Can we get our breath capacity back up without the pain? Can we get into movement without the pain? That is the ultimate goal. We don't know whether it's a diaphragm relationship. We're seeing if there's a correlation, and then we're going through some experiments to see, does it get better based on this work? If it gets better by the end, then we can go, there's probably a pretty positive correlation between the diaphragm and that pain.